as we have identified, roughly 27% of the fathers that we look after are thinking of taking their own life right at this minute because of loss of contact with their children through the family court process.
I'd just like to introduce everyone to our first speaker, Nav Mirza. Nav founded Dads Unlimited, which is an award-winning charity that supports the emotional safety of men and those that care about men in Kent and Medway. He's going to talk about his organisation. He's got a number of colleagues, obviously online, and Gay here as well. And he's also going to present a video in a moment, but the floor is yours.
Thank you very much. So just a small little change. So we used to support fathers and men across Kent and Medway. We are now supporting men and fathers and dads across England and Wales. So we started about 6 years ago. Our fundamental precept was around the issue around suicidal ideation and trying to raise awareness around the numbers of men who are taking their own life due to family breakdown and loss of contact with their children. Or at least that's how we started out. Over the last 6 years, we've created services that absolutely encapsulate and holistically support these fathers and men through the family court process. And we are the only charity in the United Kingdom that's been able to work very closely with the Bar Council and the Bar Standards Board. And we have developed a fixed fee scheme for professional legal representation for these fathers going through family breakdown. So they don't need to be a litigant in person, which really assists the family justice system. But moreover, that they get professional representation and don't need the use of Mackenzie friends or unqualified individuals to support them. The key facet behind this has been our work over the last 6 years with Public Health England and the National Health Service, as we have identified roughly 27% of the fathers that we look after are thinking of taking their own life right at this minute because of loss of contact with their children through the family court process. We have intrinsically worked so hard to try to help them and understand the barriers to why they are feeling suicidal. That could be things around, as I said, loss of contact with children, debt, previous suicide attempt, poor mental health is obviously going to be in there, but family breakdown resonates high with these men. And so we did something about that and wanted to make sure we look after them. We've also looked at we have put in place trauma-informed mental health support throughout all of our work. We run services like the Reducing Parental Conflict program. So we have a co-parenting program to support fathers and their co-parents through the system to make sure the voice of the child is at the centre of their breakdown, but that they appreciate that separation is difficult and that you have to move from an intimate relationship to a working co-parenting relationship. That's really important. So we have done a lot of work to try to prevent these men thinking about suicide across England and Wales. And I'm really grateful to say that in the last 6 years, we have tragically only lost one man to a completed act of suicide, which is testament to the work of the team and what we do and what we try and do. But as time has progressed, we've also done a lot of work around building peer support groups. And those peer support groups are bringing these dads together to talk about the difficulties they're going through. Over many, many, many years, these men started reporting about some of the abuse that they were suffering and that they had no one to talk to. Over the years, we started sharing our information with various police forces, and we are based in Kent, so we shared it with the Kent Police and Crime Commissioner. I'm not going to go too far into the details, but I'm proud to say in 2021, the Ministry of Justice commissioned us to set up Kent's first male victims domestic abuse IDVA service, looking after these guys and making sure that they're safe and that their children are safe from female perpetrated violence. I'm also very proud to say in the last 2 months, we have now expanded that Kent-based work nationally with investment from all other organisations to look after these men across England and Wales. And this is a huge step for us. What really surprises us, though, as I mentioned earlier, 27% of men going through family breakdown, not seeing their kids suffering suicidal ideation. 44% of men who are victims of domestic abuse are feeling suicidal. They have nowhere to go. There are very little, if any, refuge spaces for these men. They don't get believed. No one understands what they're going through. They are the protective factor for their children. But society doesn't see them. They are invisible. So we are working really hard to make sure that we can do this. The entire team, the way we have structured our service lines, we don't We don't signpost. One of the things when I set up DU 6 years ago was we're a doing charity. So we appoint a family separation mentor, or we appoint an IDFA, or we appoint a human being to support that human being for the length of their journey with us. Pre-COVID, those journeys could have been 27, 28 weeks. During and just after COVID, those support timeframes got up to around 77 weeks. Now we are seeing a little bit of a reduction in those times, but then that's just the way it is. The court system is very packed, and I'm very proud that I've spent quite a lot of time with Sir Andrew McFarlane over the last 2 years, speaking to him and to his colleagues across the country around some of the issues that we're dealing with. This is all about suicide prevention. This is all about improving the mental health and well-being of these men and these young boys as well. And we are now beginning projects looking at working with schools to support schools in how they communicate with young boys around supporting them with the transition into adolescence, but also talking to schools about how we're talking to girls and how they treat young boys. We have a phenomenon in this country, which is the Andrew Tate phenomenon, who is hoovering up disenfranchised young boys who feel that they are being targeted as the problem. Now, whilst that may be true or not, we're not having an equal, equitable conversation with young girls in schools as well around how they contribute to helping to develop healthy relationships as well. So we are very proud from tomorrow morning, we're beginning conversations with schools around this to say, actually, this needs to be equitable. This needs to be equal. We need to have equality here. It's a responsibility of all young people to treat other young people in a safe, respectful, dignified way. Because if we don't, cultists like Andrew Tate will be able to hoover up these young boys much more easily. So these are the works, and this is some of the frameworks, what we do and why we do it. It's important that we focus on this. Some of the other work that we do, and working with Mark and the Men and Boys coalitions around, looking at a violence against men and boys strategy, looking at how we raise and value fatherhood in the system, how we place more importance on fathers bringing something to the parenting table, and how we can say, actually, dads are just as important, men are just as important, because everybody needs to raise well-rounded young girls and boys into adult men and women. And we have an opportunity. I don't think we're doing enough, because men are, I think, humbly speaking, in an existential crisis around who we are, what our purpose is in life. And whilst the pendulum has swung appropriately so in the right way, I don't think men have actually had a moment to emancipate ourselves from the previous incarnation of who we were and who we should be now, looking in the 21st century. As a result of all of our work, I'm very proud, and I will just play a short video. Last year, we were the winners of the GlaxoSmithKline King's Fund Best Charity in the United Kingdom because of our contribution to supporting men and boys and their health and well-being, and our contribution to saving lives and preventing suicide. So thank you very much.